To better prepare for the surge of COVID-19 cases, the University of Maryland Medical Center is opening up a new unit to add patient capacity. WMER2 News' Abby Isaacs takes us inside.
This is the only unit of its kind in Baltimore City. It opens up tomorrow, adding 16 more beds to the fight against COVID-19. A valet parking lot.
It's a state-of-the-art technology to utilize in caring for patients.
Transformed into a new unit to care for COVID-19 patients.
Its intent is really to increase the care capacity that we have at the University of Maryland Medical Center.
The 16-bed modular care unit is just down the street from shock trauma. The extra beds will add to the University of Maryland Medical Center's existing inventory of 160 ICU beds. They aren't at capacity yet, but they are feeling the impacts of the surge in cases we're seeing nationwide.
Really, this unit is coming on board and going live at exactly the right time.
From concept to building and opening for operations on Wednesday, it took only 5 months, done in partnership with the state of Maryland. Each room is negative pressure capable and has the same state-of-the-art technology as the hospitals.
The technicians or providers can utilize this from the outside of the room to monitor their patient, to take an active blood pressure in order to conserve PPE, but also be able to manage to care for their patients.
Medical center staff say patients admitted to the temporary unit will have the same level of care as patients housed inside the hospitals.
Some of the patients that we will care for here may still require support from a mechanical ventilator or a breathing machine, or significant amounts of oxygen therapy, even dialysis.
The unit is prepared to care for a broad spectrum of needs. Some patients will be actively infected. Others will be recovering.
We have cared for a large number of critically ill people who have been infected with COVID-19, and that is often accompanied by a long recovery period that typically requires still an ongoing intensive amount of nursing care at the bedside.
They've already identified several patients who will move here Wednesday. In Baltimore, Abby Isaacs, WMAR2 News.